got Dr. Mitchell joining us. He's with the Center for Sports Medicine and Orthopedics, and my orthopedic doctor. I've got some knee issues now that he's helping me with. Let's talk about heat issues. Okay, first of all, how important it is to stay hydrated. And it's hard to believe that we're talking about football starting up with area high schools.
Back again.
Yeah.
So hydration is definitely one of the keys to avoiding heat injuries. The other is making sure you're used to the heat. So not going from being indoors and playing video games all summer to playing in 105-degree weather.
Yeah, and here it is, Brian saying that the heat index is close to 98 degrees.
It's here.
Can you imagine? I mean, I could imagine. I played high school football, but those pads and the helmet, and it's hot. Stay hydrated, and coaches are really aware of these heat issues too with the players.
Yeah, most of them are.
Yeah. All right, let's talk about concussions. This is something that has been headlined for the last several years, especially with the NFL. But concussions, one thing that I want, I guess, parents and everyone to know, and you're on this bandwagon too, the symptoms of a concussion. What are we looking for?
Yeah. The big categories are cognitive, so not thinking as clearly, not being able to remember things as well. They affect short-term memory. The physical symptoms are headache, nausea, throwing up, balance problems, feeling dizzy. And then also folks don't understand or appreciate the emotional or sleep disturbances. So difficulty falling asleep or being really sleepy or being more irritable, more emotional than normal.
Dr. Mitchell, the protocol with high school sports, I'm just saying high school sports, it has gotten better with medical teams and coaches what to look for when it comes to concussions, right? Yeah,
I think many more folks are better educated about what to look out for, and I think having a very low threshold to say if any concern at all, it's not worth putting the athlete back at risk and playing the day of those symptoms, and knowing that seeing a provider, a medical specialist that has special interest in concussions is appropriate.
And we've mentioned high school football, but I mean, you can get a concussion anywhere. And with our child falling down on the playground, those symptoms that you mentioned, it's vital to, if they have a headache, should we go to the ER? What does that look like when our child has symptoms of a concussion?
I think it's a good question. Symptoms of concussion in and of themselves don't necessarily require an ER visit. So feeling, having a headache, being a little bit confused, feeling nauseated, those things that we talked about earlier, if it was my child, I wouldn't necessarily be rushing to the ER. Things that would make me want to seek emergent medical attention would be numbness, feeling like the patient is drowsy, can't be aroused, that they can't move or feel part of their body, that kind of thing, where I'm not so concerned about a concussion, but something that's mimicking a concussion in some way.
The Center for Sports Medicine and Orthopedics, you guys have Saturday morning sports clinics. This is huge. Now, refresh my memory, you guys have 2 locations, right now?
Yep. We have multiple. We have a Cleveland location and a McCallie office location for those Saturday clinics. We don't have Saturday clinics at our Gun Barrel office or our Park Ridge office downtown. But yep, those 2 locations starting end of August, the last 2 weekends of August, up into the first weekend of November.
And soon, very soon, towards the end of the year, one in North Georgia?
We'll be in North Georgia, yep.
Okay, all right.
Ringgold, Fort O area, excuse me.
Fantastic.
Yep.
Thank you very much for joining us.
Absolutely.
And I'm sure I'll see you right around the corner in your office, in your territory. Saturday morning clinics, for more information, for Centers for Sports Medicine and Orthopedics, August 19th through November 4th. Here's the telephone number for more information, 423-624-2696, sportsmed.com.